Nocturia. It's a LUTS or not a LUTS. Nocturia is a low urinary tract symptom. But does it denote problem in bladder or low urinary tract symptom? Is it so? Nocturia can have systemic illness, overactive because of overactive bladder, it may be bladder problem, a kidney problem, or any systemic manifestation, or increased fluid intake, or a sleep disorder may also lead to nocturia. So there are multiple reasons of nocturia. It can be a storage disorder, as we have seen in one of the previous videos of overactive bladder, increase in frequency, urgency, and nocturia. That is overactive bladder. So it can be a storage disorder, but it can also be a emptying disorder because of a voiding dysfunction will also lead to nocturia. Yes, it can be a storage, it can be emptying, it can be a localized problem, it can be a systemic manifestation, sleep, behavior, environment, everything. So what is nocturia and how it impacts the lives? Let's find it out together. Nocturia is one of the most common urinary complaint. Yes, most common, most ignored, most superficially treated urinary complaint is nocturia. It's not treated very deeply or seen very superficially. It affects quality of life. The prevalence of nocturia increases with ages. We have seen it usually prevalent more in cases of elderly people. But having said that, it affects all the genders, yes, and from all the ages, races, it affects everyone, men and female and others also. So nocturia affects everyone. More than till age of 65, even getting once in the night for urination is nocturia. But after that, after the age of 65 years, for every decade, more than one urination is considered as normal. So 65 to 75 is get up once in the night. It's not a nocturia. If above 75, they get up two times a night. Then also it's not termed as nocturia because as the age increases, there is physiologically increase in more urinary production, polyuria. So because of that, it is raised. So it is considered as normal till 65. Even if a person gets up once in a night, it is termed as nocturia. So what is nocturia? Person, female getting up in the night for urination, which is preceded and followed by sleep. I repeat, which is preceded and followed by sleep. This is the total sleep duration when the female goes for the urination even once in a night. That is termed as nocturia. So when the person go to the sleep with the intention of sleeping and awaken in the morning with the intention of rising, getting up, and if in this duration of sleep, if the person how many ever time goes to the urination, that is the nocturia. It can be 1, 2 or whatever. Okay, so that is nocturia, preceded and followed by sleep. When you ask the history or take this, you usually notice the patient says, till I go to sleep, till 11 o'clock, I go repeated to the urination, but once I sleep, I don't go. So in history, the definition is important because to know, because nocturia, as we have seen, it is caused by many factors. To actually evaluate it, we need to know that actually she is having nocturia or sleep disorder because of sleep. Not getting the adequate sleep, she is getting up in the night and just habitual because of she is get up, she goes to urine, or actually for going to urine, she get up. So there is a difference. Because of sleep, she does not sleep well in the night, and that's why she is going for urination. Or actually, she is getting up because she feels the need to void. So history taking is very important in this. So that's a nocturia, even one episode. Now nocturia and nocturnal enuresis. These two also need to understand because these two are the more different terminology, different pathophysiology, different management, different follow-up and prognosis. Okay. Nocturnal enuresis is bed wetting. The bed gets wet and then the patient realizes or gets up after getting the bed wet that she has passed urine and then she goes for urine. Okay, enuresis, bed wetting. Patient is not aware. She passes urine in the bed. She is not aware. She is having no sensation that is full and she is about to leak. In nocturia, patient is getting up for going to urination. So both are different. Nocturia, it affects or it is affected by sleep efficacy, sleep latency. Just to in short, we know the types of sleep: NREM, non-rapid eye movement, rapid eye movement, back to our physiology. So what happens most, suppose it is normal, usually we say 8 hours of sleep. So initially, when the person sleeps, initial first 2 3 hours, that is the slow wave sleep. If any person gets up in the initially 2 to 3 hours for urination, the quality of sleep gets affected, and even in the morning when they get up, they does not feel fresh. So initially first to 3 hours, that is very good. That is slow wave sleep, stage 4 of NREM sleep. So if the person is sleeping at 10 o'clock and is getting before 1 o'clock in the, so that more the quality of life is affected. Even if the same person sleeping 10 to getting up at 6, but once getting at 4:30 or 5 in the morning for urination, the next day that maybe not, the patient may not feel so low mood, or it may be still be fresh. But getting up from the slow wave sleeps, NREM sleep, may lead to patient having decreased good sleep or decreased quality of life or more daytime sleepiness, or the may not feel fresh. Okay, so that is even the nocturia, at what timing of patient they getting to wake up for sleep. It's just not only the number of episodes, it's about the degree of bother and at what duration the patient is going for urination, at what time of duration is going from sleep to getting to wake up for sleep. So having said that, nocturia is one episode, but clinically significant we consider at when it is two or more than two episodes in the night. So that is clinically significant. The reason being this, the nocturia definition does not take into the account the degree of bother. Some may be even bothered by even once getting up in the night, and even there are patients who are not bothered by getting up 2 to 3 times also in the night, or they may have other sleep disorders, so they may not be bothered for getting up for urination. So that's why nocturia is any one episode also getting up night is nocturia, but clinically significant is usually two or more than two, or if patient is get bothered by it, then that is clinically significant. Now, why we know need, there is a need to know or treat nocturia. Why it's, what happens if you it's not treated, or what adverse effect it causes to the quality of life. It increases the risk of metabolic syndrome, low mood. If not slept at night, then obviously daytime sleepiness will be increased, impaired cognition, mood disorders, depression, increased chances to fall sick, increased chances of accident. In elderly especially, there are more chances of falls and fractures, and it's well proven and if enough literature available for it that nocturia leads to increase in morbidity and mortality. So basically, nocturia is very costly to the society. That's why we need to ask detail about it, not to be treated superficially, and to get to the root cause of it. So usually we said that nocturia, don't treat nocturia, treat the underlying cause. Nocturia, don't treat the nocturia, treat the underlying cause. So what are the causes of nocturia? It can be one of the overactive bladder, reduced bladder capacity, bladder outlet obstruction, neurogenic bladder, nocturnal, idiopathic nocturnal diaphragm overactivity, bladder calculi, ureteric calculi. It can be systemic manifestation of hypertension, diabetes, kidney, chronic kidney disease. It may be one of the early sign of chronic kidney disease, metabolic syndrome, diabetes, polydipsia, increased fluid intake at night, polydipsia, diabetes insipidus also which may be there. That will be the evening fluid intake, evening caffeine in the diet, drug induced, it may be because of beta blockers, SSRIs, steroids, caffeine, chronic inflammation of the bladder, cystitis, and many more such causes. Sleep disorders. Sleep disorders may lead to nocturia, restless leg syndrome, central apnea, obstructive sleep apnea. So, nocturia is basically beyond the bladder. They may be systemic, sleep causes, bladder, kidney, and many of the causes which may lead to nocturia. So, don't treat nocturia, treat the underlying cause of the nocturia. Okay. So, how you evaluate the patient? A patient has come, you have confirmed that there is a patient of nocturia. How you learn? In any urogynecology, it's always about good history, and a good history. Then comes the examination, your basic examination. You see the BMI, obesity, you see the peripheral edema is there or not, because at night the edema fluid mobilizes and it may lead to nocturia. So that is maybe the one of the factor. You see the BMI, you ask for any drug history, whether because of drugs it may be there. Short neck, because of the obesity, BMI and short neck, there may be increased chances of sleep disorders and it may lead to nocturia. What else in the evaluation part? Shift workers, one of the one thing. What happens with the shift workers? Those who work at night, okay, so they sleep in the day, and if in the day sleepiness they are having this urinary problem that they go to repeat it to urinate get up, then that is also as good as nocturia. Does the junior residents, senior residents, we are included in shift workers? No, I think so. Because we work 24 hours, 36 hours, 48 hours, I think so. But by the way, remember just shift workers, if they are getting up in the night, they are working in the night and they're sleeping in the day, then if they're getting up in the day for urination, then also you have to treat it as if they're having nocturia. Again, in the evaluation, important part with urogynecology is about the questionnaire. Questionnaire, there any urogynecology problem, there are questionnaires. But nocturia questionnaire is somewhat different. Reason being, it will, but as other any questionnaire, it will help you identify the severity of the disease. It will help in the follow up. But apart from that, it help to screen the patients for the causes of nocturia. There are Tango questionnaire, nocturnal quality of life index questionnaire, Pittsburgh related to sleep. So you basically know by this questionnaire that patient is having basically a problem of sleep, or weight is more, or how much the quality of life is impacted by nocturia. So how to monitor and treat the patient. So nocturia questionnaire helps basically to screen by what is the causes. So that gives you idea. So nocturia do preferably use the questionnaires. Then next evaluation, my favorite, frequency volume chart and the bladder diet. Yes. Nocturia, most common cause we have left to discuss about nocturia, that is nocturnal polyuria. Most common cause of nocturia is nocturnal polyuria. More production of urine at the night. So how you calculate that 80% of nocturia is because of nocturnal polyuria, and urine production is from kidney. Okay, so nocturia is, that's why I said it's beyond bladder, is usually one of the manifestation of any kidney disease. A patient having nocturia, specific predominant symptom that there may be some problem underlying even in the kidney. Okay, so how you evaluate that? Obviously, it's a frequency volume chart or the bladder diary. So this is the very, in the overactive bladder video we have described how to say importance of frequency volume chart and bladder diary. So nocturia, and especially nocturia and the body dysfunction, these are the condition where the bladder diary is must. Means any urinary problem, bladder diary will helpful. It will be diagnostic and even a therapeutic. But nocturia, nocturnal enuresis, and any voiding dysfunction, bladder diary will help you more better. It's actually a must for them having it. So you can have a bladder diary or a frequency volume chart. So this was in short about nocturia. Hope you liked it. Thank you.